Pasley's bio really quick. I won't read the whole thing, but the highlight. A Renaissance woman, I always say. Gay Pasley is a professional nurse, an award-winning community leader and photographer whose artistry is featured in is featured in Lao Tzu, Abstract Magazine, and Maintenant, a journal of data writing and art, and is a regular contributor to Art Mama. She is a recent graduate of the Oklahoma City Red Earth MFA program. She has presented as a lecturer for organizations such as the International Association of Forensic Nurses, Society for Photographic Education, the Ralph Ellison Foundation, the John Hope Franklin Center for Reconciliation, Gale Writing Festival. And Gay has a list of publications where she has presented, so I won't all of that, but get the point. Renaissance woman, like I said. All right, please welcome Gay Pasley to the stage.
Thank you. Confessions of a Black Nurse. It was supposed to be a routine hospice nurse visit. The text message from the office said to enter the home through the side door. I pressed my body against the large white door frame and followed the sound of the patient gasps for breath down the cramped hallway. I make a note to communicate in my documentation that the hallways are narrow. The funeral home will need this information so that they can respectfully retrieve the deceased body from the home. It is traumatic to see a recently departed family member, someone who looks like you, manhandled as they are removed from their earthly home one last time. As a hospice nurse, my job is always to ensure dignity. I find the room where my patient lay dying. Her hair, white as snow, lay damp against her scalp. Her lips are cotton candy blue due to lack of circulation, cold and chapped. The skin on her hands and feet are varying shades of splotched sky blue and cobalt. Her breaths are uneven, labored, and only a few. Old women don't run races like this for long. I'm relieved to see a family member in the home. The patient's adult son stood at her bedside. I walk over to the opposite side of the room, extend my hand to introduce myself, and he fires. "You are late." My heart starts to pound. I wasn't late. I had arrived right on time. Pain pierces my skin from the salty drops of sweat that now dampen my brow, my armpits, and my groin. The dying woman's son ignores my outstretched hand and moves past me to the other side of the room. He stands at the door, his back to me. I think that he is operating under the misunderstanding that the hospice nurse moves in and takes care of the loved one as death approaches. I was not there to replace him as the primary caregiver, and he had not given me enough time to explain. As he touches the doorknob to leave the room, I drop my hand and I say to him, "Sir, you can't leave your mother. You have to take care of your mother." He turns around and faces me, and as we both stand over his dying mother, he says, "What do you mean I can't leave?" And that is when, from the hospital bed, the dying woman gasps, "Son, do we need to take this nigger behind the woodshed?" A pin drops. I remain composed, the Black woman in the eye. this cramped space. The dying woman's body in the hospital bed. Her son, with neck and arms tinged pink from the Oklahoma sun, stands between me and the door. I would need to navigate the hallway. I had not parked for it. My head pounds as I find myself within a reliving, like an old 8mm film flickering in a dark room. A vivid memory from my early nursing career explodes to my conciliatory thought. I am a Black nurse who tends to a white family who is having a prolonged birth. The mother has pushed for hours while I wipe her brow, encourage her, and monitor the child's progress. Just as my shift ends, the newborn's head crowns. What nurse leaves a mother just as she is about to give birth? Not me. I am compelled to see the end of this birth story. We had worked so hard to get this newborn here safely. The baby needs a little more encouragement to breathe. I place the infant on his mother's chest for warmth. Skin to skin is best. I administer oxygen as the doctor has ordered, and encourage the infant to exercise his ability to breathe by tickling his tiny toes. I am pleased at how quickly this little one is going from dusky blue to bright pink. He is going to be just fine. The eldest member of the family, silver-headed and clumsy, comes over with her walker in hand and agrees to take over the important task of playing with the newborn's feet. The image is historical. A Black nurse tends to a white family. What could she possibly see? What could she possibly hear? The grandmother croons this nursery rhyme. Eeny, meeny, miny, moe. Catch a nigger by his toe. If he hollers, let him go. Eeny, meeny, miny. The room, now black like me, closed in, foreboding. This is not how we sing this lullaby at my house. These are not the lyrics. This is a racist horror of a nursery rhyme. For a brief moment, Am I in the hospital room of the newborn whose grandmother sings racist lullabies? Or am I in the bedroom of the old woman whose dying wish is to drag a nigger behind the woodshed? My present pain or my ever-present ghost? My eyes adjust to the light. I make out the shapes in the room. The smell of death, putrescine mixed with cadaverine, are in the air. This is the dimly lit room of the dying patient. The home with the narrow-minded hallways, one whose son gaslights. My cell phone first vibrates against my leg, and then it rings loudly, which interrupts my torment. I hold my cell phone high in the air and say, "It's the office. I got to take this call." This is how I escape. This is how I get out. I interrupt my supervisor and ask, "What happens behind the woodshed?" She asks, "What did you do wrong?" I try to explain hospice services. My nursing supervisor says, "She is old." I say, "I think they've done this before." She says, "You didn't really think she would rise up off her deathbed and take you behind the woodshed, now did you?" I ask, "Yes." My supervisor's right. The patient did appear to be dying. It was an issue with her heart. The patient was modeled to me. The lack of circulation to her extremities had turned her skin a blotched blue that can be found when one is close to death. Once I see modeling in a patient, I inform the family that I do not expect their loved one to live much longer, usually hours or a day before their loved one will pass away. It is a sure sign of death, but there are cases in which death eludes even the dying. I've seen those too. Now you're going to have to get over this. Your sisters in nursing are going to think you are playing the nurse card, playing the race card. It is par for the course that a person of color would report a racist incident in a racist world and be accused of sleight of hand. The race card played, I would remain on the case. Like my literary ancestor, Ralph Ellison, I wondered, what did I do to be so Black? It was then that my fixation on what happens to the nigger taken behind the woodshed began. I wonder about the wood. Is it splintered? Is it smooth? How is it that I know? What is it that I know? Fractured experience. In the weekly team meeting, I say to the care team, they want to take a nigger behind the woodshed. I can't stop talking about it. I find myself amidst a flood of see no evil, hear no evil, speak no evil. Their lukewarm responses are a collective amnesia. State Representative Don Ross reminds us in his prologue, a report by the Oklahoma Commission to Study the Tulsa Race Riot of 1921, that the French political historian Alexis de Tocqueville noted, once the majority has irrevocably decided a question, it is no longer discussed. This is because the majority is a power that does not respond well to criticism. My dilemma is now fodder for office jokes. One redheaded nurse says, oh, I know what happens behind the woodshed. My uncles liked the sisters, and they would take them behind the woodshed and have sex with them. Not my dad, my uncles. We found a bunch of them with hair the same color as ours, and some with the same last name. Figured we would leave well enough alone. No use bringing up history. When I read this essay, most people ask, did this really happen to you? Did they really make you go? Did I ever leave the room? Have any of them?
Wow. Oh, that was a lot. I know. Thank you. Thank you. As you were reading, I was sitting there just thinking about some practitioner and these nurse before that, right? Licensed practical nurse before that, and my mother was a CNA. I grew up in a house, and similar stories, not to that regard, but things, right, that would happen at work, way, and not leaving and having to pay. So anyway, so thank you for that, and I'm sure we know lots of folks. Thank you.